Hi, I am Peter Glowicki from Mayo Clinic, Editor-in-Chief of the Journal of Vascular Surgery. I am pleased to introduce 4 excellent papers from the September issue of the JVS. Each are freely available to read or full text download for the next 2 months. The first article I'd like to introduce today is the editor's choice article this month. It is entitled Popliteal Scoring Assessment for Vascular Extremity Injuries in Trauma Study. This is also our CME article. It is a multi-institutional retrospective study written by Dr. Lei and O'Banion and co-authors from California, Colorado, Utah, and Arizona. The study included 355 patients with popliteal artery injuries. 16% of them required a major amputation. Risk factors for amputation included systolic blood pressure less than 90 millimeters of mercury, associated orthopedic injury, lack of preoperative pedal Doppler signals, or a lack of palpable pedal pulses if Doppler was not available. Assigning a POPSAVIT, Popliteal Scoring Assessment for Vascular Extremity Injuries in Trauma score to each risk factor, a score of greater than 3 was found to maximize the sensitivity and specificity for a high risk of amputation. The POPSAVIT score is a simple method to predict the risk of amputation in patients with popliteal artery injuries. The next article in this issue is entitled A Population-Based Study of Postendovascular Aortic Repair Rupture During 15 Years by Dr. Matthias Andersson and colleagues from multiple centers in Sweden. Among 6,470 patients with abdominal aortic aneurysm treated with endovascular repair, 86 patients, 13%, had rupture during a mean of 3.9 years for an incidence of 3.4 per 1,000 person years. Freedom from rupture was 98% at 5 and 96% at 10 years after EVAR. The incidence of rupture after 8,389 open surgical repairs was only 0.9 per 1,000 person years. Predictors for rupture included ruptured aneurysm at index surgery and age. The take-home message is that post-EVAR rupture is a rare, but it is a dangerous complication, and there is a need for long-term follow-up of these patients. The next article this month is titled Long-Term Safety and Efficacy of Angioplasty of Femoropopliteal Disease with Drug-Coated Balloons from the ACO-ART-1 trial. It was written by Dr. Yong Xu and colleagues from multiple centers in China. In this randomized controlled trial, 200 patients with femoropopliteal disease received balloon angioplasty, and 100 were treated with drug-coated balloon and 100 with uncoated balloon. 5-year freedom from clinically driven target lesion revascularization for the drug-coated balloon was 77.5%, significantly better than for the uncoated balloon that was only 59.1%. 5-year freedom from all-cause mortality was similar in both groups, 82.7% versus 73.2%. Our final article is a health insurance claims analysis on the effect of female sex on long-term outcomes after peripheral endovascular interventions for symptomatic peripheral arterial occlusive disease. This was written by Dr. Franziska Heidemann and colleagues from Hamburg, Wuppertal and Erlangen in Germany, and from Lebanon, New Hampshire in the United States. In a matched cohort of 35,232 patients with symptomatic PAD, at 5 years, female patients exhibited lower mortality, fewer amputations or death, and fewer cardiovascular events or death than men. The association between female sex and improved long-term outcomes was most pronounced for the patients with intermittent claudication. These were just 4 of the many excellent papers we published in the September issue of the JVS. Please read our journals, follow us on social media, and send us great manuscripts for publication. Thank you for watching, and see you next time for the highlights of the October issue of the Journal of Vascular Surgery.